Hey friends, welcome back to another YouTube video with SMNP Reviews. I'm Ashton, a family and emergency nurse practitioner and one of the instructors with the SMNP team. I've been a nurse practitioner for almost a decade, and during that time I've had the opportunity to work in a variety of settings, including the emergency department, occupational health, urgent care, crisis centers, even primary care. In this video, I'm going to share with you a little about my current role, which is working with underserved populations in a rural primary care clinic. And if you're searching for your dream nursing job, definitely check out our job hunt course and be sure to hit that subscribe button. In primary care, you have to know about a lot of different body systems and disease processes. Every day is different and no two patients are the same. I care for patients across the lifespan with both acute and chronic conditions. Some of the most common diagnoses I manage are hypertension, diabetes, hyperlipidemia, and mental health concerns. My job involves doing assessments and diagnoses, developing treatment plans, interpreting lab results and other diagnostic tests, and performing wellness exams. Another very important part is providing education to patients and their caregivers and coordinating care. A large part of primary care is focused on primary prevention, so making sure that patients are up to date on their vaccinations as well as their screening such as mammograms and colonoscopies, encouraging healthy eating, exercise, and smoking cessation are all important aspects of primary care as well. Our office consists of myself, another nurse practitioner, our collaborating physician, our receptionist, and our nursing staff. However, I collaborate with a lot of specialists and healthcare entities outside of the office, including home health and hospice agencies, pharmacies, and physical or occupational therapists, just to name a few. I'm also in regular consultation with other healthcare clinicians such as cardiologists, endocrinologists, psychiatrists, etc., to ensure that we are providing excellent continuity of care to our patients. And so I usually arrive at the office around 7:45 a.m. I start the morning by reviewing any labs or messages left from the previous day. I return any calls or follow up on any new results before seeing my first patient. I typically see 7 to 10 patients before lunch and a similar volume in the afternoon. The majority of these visits are routine follow-up visits mixed with a few episodic visits. I use the lunch hour to finish morning charts, grab a quick bite to eat, and return any phone messages from the morning. These messages may be refill requests, general patient questions, or calls from outside facilities such as home health. And then I usually see my last patient around 4:15 p.m., and then I make every effort to finish up any remaining charts before ending my day. And I usually leave the office by 5:30 p.m. I absolutely love taking care of patients within my community and managing the complexity of their conditions. I tend to get bored with one topic very easily, which is one reason I've always shied away from specialties. Every day is different and never boring. The schedule isn't too bad either. Having weekends off, no night shifts, and no call is another added bonus for sure. Working in a rural area, it is often difficult to access many resources that nurse practitioners practicing in more urban areas may have. Healthy food and medications are expensive, so oftentimes I have to get creative to figure out the best plan of care for my patient and do the best I can with the resources available, such as patient assistance programs and local food banks. Dealing with insurance companies and prior authorizations for medications and procedures can also be very frustrating and overwhelming at times, but thankfully I have a great team to help balance out that workload. So how can you embark on a career as a primary care NP? Number 1, networking. Leverage those relationships you have already built in your career as a nurse or in your clinical rotations. Also, tap into your resources. When I first began working in primary care, I had evidence-based guidelines taped up all over my office. Also, I think it's really important to build a good rapport with your colleagues and your consultants. Learn what community resources are available for your patients and how they can access them. Primary care can definitely be challenging, but I have found it to be a very rewarding and fulfilling career. And if you're interested in learning more tools and skills to thrive as a nurse practitioner, definitely check out our job hunt course. Also, if you're looking for a free, supportive community of new nurse practitioners, make sure you join our Facebook group, and these will be linked in the description. And that's a wrap. I hope you found this video helpful as you prepare for your job as a Real Deal NP. Make sure to subscribe to our channel and check out our other videos. Until next time, friends.